If you are over 60 and being jolted awake by excruciating leg cramps in the middle of the night, or feeling like your legs are heavy and weak when you try to climb stairs, what I'm about to share could be the answer you've been desperately searching for. There's one crucial vitamin that many seniors are severely lacking, and this deficiency could be the hidden cause behind your leg pain, muscle weakness, and those painful cramps that strike without warning. I'm talking about vitamin D, and the connection between vitamin D deficiency and leg problems in seniors is more profound than most people realize. What's truly shocking is how many doctors overlook this simple deficiency when treating leg cramps, muscle weakness, and mobility issues in older adults. The statistics are staggering. Nearly 80% of seniors have insufficient vitamin D levels, yet most don't even know it. This isn't just about bone health, though that's certainly important. Vitamin D plays a crucial role in muscle function, nerve signaling, and maintaining the strength and coordination that keeps you mobile and independent. As we age, our bodies become less efficient at producing and absorbing vitamin D. Our skin becomes thinner and less capable of synthesizing vitamin D from sunlight. Our kidneys become less efficient at converting vitamin D into its active form. Meanwhile, many seniors spend more time indoors and may have dietary restrictions that further limit vitamin D intake. This creates a perfect storm for vitamin D deficiency, and your legs often bear the brunt of this nutritional shortfall. Let's start with those dreaded leg cramps that can wake you from a sound sleep with pain so intense it leaves you gasping. Muscle cramps occur when your muscles contract involuntarily and refuse to relax. While there can be several causes, vitamin D deficiency is often an overlooked culprit. Vitamin D is essential for proper calcium absorption and muscle function. When you don't have enough vitamin D, your muscles can't maintain the delicate balance of calcium and other minerals they need to contract and relax properly. Research published in the Journal of the American Geriatric Society found that seniors with higher vitamin D levels experienced significantly fewer muscle cramps and less muscle pain overall. The study followed over 2,000 participants and found that those with adequate vitamin D had 30% fewer episodes of nighttime leg cramps. Vitamin D also plays a crucial role in nerve function. Your nerves send signals to your muscles telling them when to contract and when to relax. When vitamin D levels are low, these nerve signals can become erratic, leading to involuntary muscle contractions and cramping. Beyond cramps, vitamin D deficiency can cause a general sense of muscle weakness that many seniors mistakenly attribute to normal aging. You might notice that climbing stairs feels more difficult, getting up from a chair requires more effort, or your legs feel heavy and tired even after minimal activity. This isn't just normal aging. It is often a sign that your muscles are not getting the vitamin D they need to function optimally. Studies have shown that seniors with adequate vitamin D levels maintain better muscle strength and have significantly lower rates of falls and fractures. The vitamin helps maintain muscle fiber integrity and supports the production of proteins that are essential for muscle contraction. Vitamin D also influences balance and coordination through its effects on the nervous system. Many seniors who struggle with unsteadiness or feel like their legs aren't responding properly may actually be dealing with vitamin D deficiency rather than an irreversible age-related decline. The recommended daily intake of vitamin D for adults over 60 is 800 to 1,000 international units, but many experts believe this may not be sufficient for optimal health. Some research suggests that seniors may need 500 to 2,000 IU daily to maintain adequate blood levels. However, the only way to know your true vitamin D status is through a blood test measuring 25-hydroxyvitamin D. Optimal levels are generally considered to be between 30 and 50 nanograms per milliliter, though some experts recommend levels closer to 40-60 mg/ml for optimal muscle and bone health. If you're experiencing leg cramps, muscle weakness, or mobility issues, ask your healthcare provider to check your vitamin D levels. This simple blood test could provide the answer to problems you've been struggling with for months or even years. While sunlight exposure is the most natural way to boost vitamin D levels, it becomes less practical and effective as we age. During winter months or in northern climates, adequate sun exposure may be impossible. Dietary sources of vitamin D include fatty fish like salmon, mackerel, and sardines, egg yolks from pasture-raised chickens, and fortified foods like milk and cereals. However, it's very difficult to get adequate vitamin D from food alone. This is why vitamin D supplementation becomes crucial for most seniors. Vitamin D3, also called cholecalciferol, is generally preferred over vitamin D2 because it's more effective at raising and maintaining blood levels. When choosing a vitamin D supplement, look for vitamin D3 rather than D2. Take it with a meal that contains some fat, as vitamin D is fat-soluble, and absorption is enhanced when taken with dietary fats. Many seniors find that taking vitamin D with their largest meal of the day improves absorption and helps them remember to take it consistently. If you've been diagnosed with severe vitamin D deficiency, your healthcare provider might recommend higher doses initially to replenish your stores more quickly. Some doctors prescribe 50,000 IU weekly for several weeks before transitioning to a daily maintenance dose. It's important to note that vitamin D works synergistically with other nutrients, particularly magnesium and vitamin K2. Magnesium is required for vitamin D metabolism, and many seniors are deficient in magnesium as well. Foods rich in magnesium include leafy greens, nuts, seeds, and whole grains. If you're supplementing with vitamin D, consider whether you're getting adequate magnesium as well. Vitamin K2 helps direct calcium to your bones, rather than allowing it to accumulate in soft tissues. This is particularly important when supplementing with vitamin D, as increased calcium absorption needs to be properly directed. Beyond supplementation, there are lifestyle factors that can help optimize your vitamin D status and reduce leg cramps. Regular weight-bearing exercise helps your body use vitamin D more effectively and maintains muscle strength. Even gentle activities like walking, tai chi, or simple resistance exercises can help improve muscle function and reduce cramping episodes. Staying adequately hydrated is also crucial for preventing muscle cramps. Dehydration can exacerbate cramping, especially when combined with vitamin D deficiency. Managing stress levels can also help, as chronic stress can interfere with vitamin D metabolism and muscle function. If you're currently taking medications, be aware that some can interfere with vitamin D absorption or metabolism. These include certain cholesterol medications, corticosteroids, and some seizure medications. Always inform your healthcare provider about any supplements you're taking, especially if you're on multiple medications. The timeline for improvement can vary depending on how deficient you were initially. Some people notice improvements in muscle cramps and weakness within a few weeks of starting appropriate vitamin D supplementation. However, it can take several months to fully replenish vitamin D stores and achieve optimal blood levels. Don't get discouraged if you don't see immediate results. Consistency is key. Keep a simple log of your symptoms, including the frequency and severity of leg cramps, feelings of muscle weakness, or balance issues. This can help you and your healthcare provider track your progress. Some seniors notice that their sleep quality improves as their leg cramps decrease. Others find that daily activities become easier and that they feel more confident about their mobility. It's worth noting that while vitamin D deficiency is a common and often overlooked cause of leg problems in seniors, it's not the only possible cause. Other factors like medication side effects, circulation issues, nerve problems, or electrolyte imbalances can also contribute to leg cramps and weakness. However, given how common vitamin D deficiency is among seniors and how safe and affordable supplementation can be, it's often worth addressing this potential cause first. The broader health benefits of maintaining adequate vitamin D levels extend far beyond leg health. Proper vitamin D status supports immune function, cardiovascular health, and cognitive function. Research suggests that seniors with adequate vitamin D levels have lower rates of respiratory infections, better mood regulation, and reduced risk of certain chronic diseases. Don't let leg cramps and muscle weakness rob you of your independence and quality of life. These symptoms are not an inevitable part of aging, and they don't have to be something you just learn to live with. A simple blood test and appropriate vitamin D supplementation could be the key to stronger legs, fewer cramps, better balance, and renewed confidence in your mobility. Start by having that conversation with your healthcare provider about checking your vitamin D levels. It could be the first step toward reclaiming the strong, comfortable legs you remember having and enjoying a more active, pain-free life. Your legs have carried you through decades of life. Now it's time to give them the nutritional support they need to continue serving you well for years to come.